welcome to South First. I am Chetna Belgire. So here are a few cases which I'm going to just brief you about it, and then we will go a little further on this. So have you heard of a person who fainted each time he listened to a Kishore Kumar song? There's a person who sits to read, and the moment he starts reading, he kind of has a seizure. In another case, sudden flashes of light would make this person's muscles stiffen, then he would faint too. Sounds very interesting, right? So these three are kind of examples of a condition called reflex epilepsy, where seizures are triggered by specific stimuli. To speak on some of these interesting, not very popular form of epilepsy as part of National Epilepsy Awareness Month, we have with us Dr. Kalyani Dilip Karkare, a renowned neurologist and a leading expert in the field of epilepsy at Manipal Hospital in Millers Road in Bengaluru. Dr. Kalyani, welcome to South First.
Hello, thank you. Thank you for having me here.
Thank you. So, doctor, straight away, could you explain what exactly is reflex epilepsy and how does it differ from other types of epilepsy?
Sure. So, first of all, a brief definition of epilepsy.
Yes.
Epilepsy is a tendency to have seizures. Okay. So, seizure is like one-time attack of convulsions. But when you get two or more seizures separated minimum 24 hours, or you have one seizure, but you have a 60% higher risk than a general population to have another episode, then you are called as epileptic. So only one episode of seizure is not having epilepsy. Epilepsy is a tendency to have seizures. Okay. So one of the interesting forms and which makes the brain more intriguing and interesting is reflex epilepsy, because it kind of tells us the kind of networks which are involved when we respond to internal as well as external stimuli. So reflex epilepsy is a kind of epilepsy or seizures which come frequently, specific to certain stimuli. They can happen in patients who are otherwise also having spontaneous seizures. So it's not necessary that reflex epilepsy means patient must get that stimulus only to get a seizure.
Okay.
Sometimes it's a part of a general epilepsy of which some of them are triggered and some of them are spontaneous. So any seizures which are coming time locked or temporally related or causally related to a particular stimulus, which can be an external or internal stimulus, that we call as a reflex epilepsy.
Okay. So if you could just brief us on your clinical practice, if you could tell us some of the interesting stimuli which has actually triggered this kind of epileptic. And see, this is something which is very, unheard of to many people, and they may not even know that this is epileptic attack on them, right? So what are some of those kind of triggers that you have seen in your clinical
practice? Yes. And I think the whole point on, from the doctor point of view, it is interesting for me because it opens up so many dimensions about understanding the brain. But from a public point of view, it is important to even know that this kind of problem exists, because no one would believe that you would have a fit or a seizure just because you listen to a type of music, a particular song, and even just by thinking, So I'll give you few examples. Like the commonest actually and very well known is a photosensitive epilepsy. Photo is light. So these people are sensitive to lights. The lights can be a flicker, like for example, the light which is flickering at a very high frequency. For example, people playing video games or people visiting pubs or discos where there are a lot of disco lights. Those alternative contrast, that is what is going to trigger seizures, which is common in people who otherwise also have something what we call as generalized epilepsy. That means people who have epilepsy otherwise also would be sensitive to light. So in these people, we always suggest that we should avoid excessive use of gadgets or video games and those kind of things, because that may trigger seizures. So those are kind of common, but in them also interesting ones are, like we have something called as a Pokemon epilepsy. So there was an epidemic in Japan because one of the episodes of the Pokemon animation or a cartoon, it caused seizure at one time in several hundred children across the country in Japan. So yes, so that particular episode had certain very high contrast features, and since then there are many regulations about TV screens. And they say as compared to the old TV screens, like they have those no different frequencies at which the gyrations. If the current TVs like plasma or LED TVs, they have less of those problems. The old TVs had more of those problems. LED TV is supposed to be better than even a plasma TV. So the TV induced, then there was a video game induced called as Space Invader Epilepsy. So there is a video game specific called Space Invader, where playing that, a group of young males got seizures. So all these indicate that there is a normal cortex, like normal part of the brain, which responds to a particular stimulus. So for example, if I'm looking at something, the back portion of my head called as occipital cortex is considered as a visual cortex. That is a cortex which makes me find meaning into the object which I'm seeing. The eyes are just collecting the signals, but making meaning what you are seeing happens there. So those group of neurons, when become hyper excitable, they would throw seizures by, and the factors would be like high contrast. That's why they say that when you're watching television, if there is too much of dark, that contrast between the surrounding dark and a very high luminant TV would trigger seizures. So high contrast frequencies of more than 100 hertz of the ongoing thing, there are certain physics behind that the cycles which are running of 15 to 25%. So there are many small things which would tell. There are certain pattern sensitive epilepsies, like some people will get seizures just by looking at a checkerboard pattern, like the pattern which we see in a chessboard, or just vertical stripes. So we see those visual illusions and all. No, people show us the illusions. Look at one side, the things move. Correct. Even those patterns can cause epilepsy in some.
So is that how the reading also, like when they're reading, is that the eye movement which actually causes epilepsy? Because I've heard of.
So there is something called reading epilepsy, which is very interesting. It is different than a photosensitive epilepsy. So here, photosensitive epilepsy is more related to vision. There is no cognitive processing in it. But in reading epilepsy is a part of language related epilepsies. So if you're talking about a language, so when I'm speaking, it's just a speech. But when I say language, it is speech plus reading plus writing plus gestures. So language is a way of communication by different means. And reading is one form of language related epilepsy. So these people, when they start reading, they would get seizures. And these seizures are very peculiar, that they will get actually oromasticatory, we say, like near the mouth and near the jaw. They start having jerks, which cause like a clicking kind of sound. And before they could realize, they land up into the big one, that what people say is a generalized seizure. So here what is involved is a cognitive epilepsy. That means the process of comprehending what you are reading is going to trigger a certain group of neurons which will cause epilepsy.
So is there any particular, can it have like a particular subject in it, or is it just any kind of, could it be any kind of reading? I mean, is it like specific to something?
They say that, so they say whenever there is a more kind of a complex interpretation of things, like you reading a novel versus you reading a physics book or a new math concept, probably would give rise to seizures. Again, it is specific to a particular patient. Sometimes they say even the idea of reading, like if you are thinking of reading, that can induce seizures in some.
So this has nothing to do with your stress levels or anything, right? I mean, it's not that you're so stressed that it is actually leading to epileptic.
No,
it's not that.
So
there are a lot of myths around that. A lot of people have.
Yeah, I agree. Yeah, and that, like, people may use it for like that, oh, my child should not be stressed and I should not stress him for reading for exam. It's not like that. So this reading is a very specific stimulus to a particular portion of your brain, and it is not related to stress. So it is not that if I'm getting stressed and I'm reading and I got a seizure, I should quit reading. So the most important thing about reflex epilepsy is you should have a consistent response of that particular stimulus to get seizures.
Okay.
Just because you had a seizure when you were reading doesn't prove it to be reading epilepsy.
Of other than the photosensitive reflex, which you said is very common in your clinical practice, which are the other ones that you actually see here in India, in Bangalore?
Yeah, so especially in South India, the commonest is hot water epilepsy. Very, very common. I mean, very common. So what happens is most of the Indians are used to have no hot water bath, and they pour buckets of water on the head. So it is common in people who, when they start pouring water on the head, they would suddenly become unconscious. They would talk something irrelevant. They may look like as if they are hallucinating. So they may not necessarily get the major one, but they just look like they are lost in the surroundings. So hot water epilepsy, there is a particular gene also identified, and it is more common in South India because of the propensity of the consanguineous marriages. Like there is a lot of inbreeding, like people marry within their families, so the genes are shared more. So hot water epilepsy is very common in South Indians. Okay. So for that, what is suggested is, first of all, if possible, you can take the hot water on the body, but kind of a lukewarm water on the head. That's the way to do it. Like the temperature, it is related to the temperature. So that has to be handled. And sometimes we have to give a tablet, we say as clobazam, which you have to plan like 1.5 to 2 hours prior to bath. You take it and then you go for a bath.
Okay.
Those kind of things.
Okay. So in such situations, like when you said it has to be a repeated stimulus, and that's when you actually know that this is epilepsy. That is one of the ways of identifying. So is there any lifestyle changes that they need to do? What are the other than your medication, what are the other treatment strategies that they have to follow? Because this is something which may disrupt their everyday life, right?
Sure. So before I just tell about the lifestyle modification, I would just enlist a few of the reflex epilepsies, just name them. Sure. So the other common one is eating epilepsy, like even the thought of food or a particular food, like they get it only when eating rice, but not otherwise. So eating epilepsy, reading we have covered. Then there is new cognitive epilepsy. That means even thinking of a concept like a complex calculation can cause seizures. Orgasm can cause seizures. Toothbrush epilepsy is there. A specific stimulus of toothbrushing epilepsy. There are praxis-induced seizure. That means if I'm planning a particular motor act, just that planning can cause seizures. There are seizures which are sensitive to touch. There are seizures which are called as startle seizures. That means a sudden loud sound, and people will suddenly drop. So there are many varieties. So
music as well.
Musicogenic epilepsy. Yes, like a particular melody can cause a seizure. Even thinking of the song can cause a seizure. So
does it always
it's just amazing.
So does it always have to come with an experience of something to trigger this? As in, I remember writing about a case where this person had actually lost his wife, and she was very fond of, both of them were singers, and they were really fond of Kishore Kumar songs, and that's why I quoted that example. This was in Hyderabad. Yeah. So now, does it always have to be with some kind of an experience?
No, so sometimes they say that so emotion play a larger part, and some of the songs are related to, like, if there is emotionally charged, what they have found in research is even the emotional songs, they trigger more seizures as compared to a neutral sound. Okay. Like even a sound can cause seizures, correct? But if a song is charged with emotions or create, some songs you hear and you really feel emotional about it, and especially you have an emotional tag with it, then the chances of having seizures are more. Okay. Saying all that, I would emphasize that we should never blame seizures on any trivial matter unless we are sure about it. That's why I'm saying, like, if someone gets a seizure while listening to a music, unless we know that it is a consistent pattern, we should never blame it on that. But yes, particular tunes of certain frequencies are supposed to have effect on the audiogenic, the cortex, which is present in the brain, which is responsible for hearing, can cause seizures. But yes, emotionally charged music has much more impact than a neutral music.